Welcome to Brainy-tainment, the ultimate hub for your brain's entertainment and enlightenment. We're here to unravel the mysteries of the world around us, one intriguing topic at a time. Today, we are peeling back the curtain on a procedure that's often shrouded in mystery, liposuction. We'll delve into what happens during this procedure, demystifying it step by step. So, buckle up as we embark on this captivating journey into the world of liposuction. Stay tuned and get ready to boost your knowledge about liposuction. First things first, what exactly is liposuction? Liposuction, often referred to as lipo, is a popular cosmetic procedure designed to reshape and slim specific areas of the body by removing excess fat deposits. It's a tool to enhance your body's contour and proportion, offering a more balanced and pleasing aesthetic. So, who might consider this procedure? Well, liposuction isn't a weight loss tool, but rather a method to remove stubborn pockets of fat that resist diet and exercise. It's a solution for those who, despite a healthy lifestyle, struggle with persistent fat in areas like the abdomen, thighs, hips, or buttocks. Remember, liposuction is a medical procedure, and as such, it should be performed by a qualified and experienced professional. It's not a quick fix, and like any surgery, it comes with risks and recovery time. Now that we understand what liposuction is, let's delve into the step-by-step process. Every liposuction journey starts with a consultation. This initial meeting is far more than a mere formality. It's an essential first step, a vital opportunity to establish communication and understanding between patient and surgeon. It's during this consultation that the surgeon will gather crucial information about the patient's medical history, current health status, and aesthetic goals. The patient, on the other hand, will have the chance to ask questions, express concerns, and gain a better understanding of what the procedure entails. It's a two-way street where both parties work together to ensure that the procedure is suitable, safe, and likely to achieve the desired results. The consultation also provides the surgeon with the opportunity to evaluate the patient's skin elasticity, body type, and fat distribution, enabling them to form a tailored surgical plan. This collaborative approach helps foster a sense of trust and confidence. Once the consultation is complete and both patient and surgeon are on the same page, they move on to the next step. Preparation is key in any surgical procedure, and liposuction is no exception. Before the procedure, your surgeon will perform a series of health checks to ensure your body is fit for surgery. This comprehensive assessment includes blood tests and other diagnostic tests, and may also involve discussions about your medical history. It's essential to be open and honest during these consultations, as any pre-existing conditions could impact the procedure's success or your recovery time. Another crucial part of the preparation process is fasting. It's not uncommon for patients to be asked to fast, that is, abstain from eating or drinking, but just for a period of time before the procedure. This is because anesthesia, which is used to keep you comfortable and pain-free during liposuction, can cause nausea if there's food in your system. Let's not forget about the importance of mental preparation. It's perfectly normal to feel a mix of excitement and anxiety before a procedure like liposuction. Take time to take care of your mental health, whether that's through meditation, talking to friends and family, or discussing any concerns with your medical team. Lastly, there are some practical steps to take. You'll need to arrange for someone to drive you home after the procedure, as you'll be feeling groggy from the anesthesia. It's also a good idea to prepare your home for your recovery period, such as setting up a comfortable space to rest and making sure you have easy access to necessities. With preparation complete, it's time for the main event. In the operating room, the real work begins. This is where the magic happens, the place where skilled surgeons and their highly trained teams employ their expertise to sculpt and redefine the human form. Liposuction, in its essence, is a step-by-step procedure that requires precision, artistry, and a deep understanding of the human body. But let's not get ahead of ourselves. Let's take it from the top. The first step is the administration of anesthesia. This can be local or general, depending on the extent of the procedure and the patient's requirements. The anesthesia ensures that the patient is comfortable and pain-free throughout the process. Once the anesthesia has taken effect, the surgeon makes small incisions in the areas where fat is to be removed. These incisions are typically about 1/4 to 1/3 of an inch long and are placed in hidden skin folds or contour lines to minimize visible scarring. Next, the surgeon introduces a thin hollow tube known as a cannula into the incisions. This cannula is connected to a vacuum that provides suction. The surgeon gently moves the cannula back and forth to loosen the fat cells, which are then suctioned out of the body. This step requires a surgeon's keen eye and steady hand to ensure that the fat removal is even and results in a smooth, natural-looking contour. It's important to note that liposuction is not a weight loss procedure. It's a body contouring technique designed to remove stubborn pockets of fat that have proven resistant to diet and exercise. The main goal is to enhance the patient's natural silhouette and improve the proportions of the body. Once the desired amount of fat has been removed, the incisions are closed using fine sutures. In many cases, a compression garment is applied to the treated area to help reduce swelling and support the healing tissues. Throughout the procedure, the surgeon's team monitors the patient's vital signs to ensure their safety. This team includes an anesthesiologist, surgical nurses, and possibly a surgical tech, all of whom play a crucial role in the patient's care. The procedure is over, but the patient's journey is far from complete. The next phase, recovery, is just as important for achieving the best possible outcome. But that's a topic for our next scene. Stay tuned. Recovery is a crucial part of the liposuction process. It's the time when your body adjusts and heals from the procedure, allowing you to see the final results of your transformation. In the immediate post-operative period, patients often experience some discomfort, swelling and bruising in the areas where fat was removed. It's normal and part of the body's healing process. You'll be provided with a compression garment to wear, which helps reduce swelling and supports the areas undergoing changes. In terms of medication, your doctor will likely prescribe pain relievers to help manage any discomfort. It's also important to keep the incision sites clean to prevent infection. Now, the long-term recovery phase is the time when you'll truly start to appreciate the changes. Over the next few weeks and months, as the swelling subsides, you'll begin to see the new contours of your body. It's a rewarding period, but also one that requires patience. But it's not all roses and rainbows. There can be complications. Some common ones include infection, bleeding, and changes in skin sensation. More serious complications, although rare, can include deep vein thrombosis or damage to internal organs. That's why it's absolutely crucial to follow your doctor's instructions to the letter during the recovery period. Regular follow-up visits will ensure that your recovery is on track and any potential complications are caught early and treated. Recovery is the final step, completing the patient's liposuction journey. It's the period when you heal, adjust, and finally get to enjoy the results of your decision to undergo liposuction. So we've taken a journey through the liposuction process from consultation to recovery. We started off with understanding what exactly liposuction is. It's not a magic wand for weight loss, but a surgical procedure to remove excess fat deposits and contour specific areas of the body. This procedure is often chosen by those who have tried diet and exercise but still struggle with stubborn pockets of fat. The consultation stage, as we've learned, is crucial. It's a chance for you to discuss your goals and expectations with the surgeon. It's also the time for the surgeon to evaluate if you're a good candidate for the procedure. Factors such as your overall health, skin elasticity, and realistic expectations all play a part. Once your surgeon has given you the go-ahead, we move on to the preparation phase. This involves a series of pre-operative instructions, which may include a change in diet, stopping certain medications, and arranging for someone to drive you home post-surgery. Then comes the main event, the procedure itself. It involves making small incisions, inserting a thin tube called a cannula to break up and suction out fat. Depending on the extent of the procedure, it can either be performed under local or general anesthesia. Post-procedure, we discuss the recovery process. It's important to note that recovery times can vary greatly from person to person, but generally one can expect some swelling, bruising, and discomfort. You'll also need to wear a compression garment for a few weeks to help reduce swelling and support the treated areas. And there we have it, a comprehensive overview of what happens during a liposuction procedure. It's certainly not a decision to be taken lightly, and it's important to remember that while liposuction can enhance your appearance and self-confidence, it won't necessarily change your looks to match your ideal image or cause other people to treat you differently. Remember, Liposuction is a serious procedure that should be considered carefully. Thanks for joining Braintainment today. Don't forget to subscribe for more enlightening content.